Hello and welcome. Today we're jumping right into a medical mystery, one that starts with a really alarming clue, one that's written right on the body itself.
So, let's just think about this. Can you imagine looking in the mirror one day and realizing your skin and even the whites of your eyes have turned yellow? It's definitely concerning, right? But what is your body actually trying to tell you?
And right there, that's our first huge clue. Jaundice isn't really the disease. Think of it more like a flashing warning light on your car's dashboard. And the thing that's making that light flash, it's a yellow substance called bilirubin. And that is our main person of interest in this whole mystery.
So let's treat this like a real investigation. Jaundice is the body's yellow alert, and our job is to figure out what exactly set it off.
Now here's the thing. We all have a little bit of bilirubin in our blood. Normally, it's kept at super low levels. That yellow alert, the jaundice, it only really becomes visible to the naked eye when the level crosses a certain line, about 3 milligrams per deciliter. That's the tipping point.
Okay, so before we can possibly understand why things go wrong, we first have to understand how they're supposed to go right. So let's follow the normal, everyday journey of bilirubin as it moves through the body.
You can think of this whole process like a super efficient factory assembly line. First up, production. Old red blood cells get broken down and recycled, and bilirubin is made as a waste product. Then, it gets transported over to the liver. Now, the liver is the main processing plant, right? It works its magic and makes the bilirubin water-soluble. From there, it gets mixed into bile, shipped out to the intestines, and finally, it's eliminated from the body. And here's a fun fact, it's actually this bilirubin byproduct that gives stool its normal brown color.
So here's the bottom line. Jaundice is just a signal that something, somewhere along this 5-step assembly line, has broken down. Any kind of glitch causes a backup, bilirubin levels start to rise in the blood, and poof, that yellow warning light clicks on. So, when a patient shows up with jaundice, the doctor immediately puts on their detective hat. The first thing to do? Start gathering clues. And that begins with a simple interrogation. Now, I know this might sound like a weird, personal question, but the answer gives the doctor one of the most important first clues in the entire investigation. Seriously.
Okay, so why is this question so clever? Well, remember how the liver processes bilirubin to make it water-soluble? If that processed bilirubin backs up, it has nowhere to go but into the bloodstream. And then it gets filtered out by the kidneys. And that makes the urine dark, like tea or cola. This tells our detective the problem is happening either in the liver or after it. But if the urine color is normal, that suggests it's the raw, unprocessed bilirubin that's building up, which points the finger at a problem happening before the liver ever gets involved.
All right, next up from our medical detective, another seemingly simple question that is actually critically important.
Remember we said bilirubin gives stool its color? Well, if a patient says their stool is pale or kind of clay-colored, that is a massive clue. It means the bilirubin isn't making it to the intestines at all, and that points very strongly to a physical blockage after the liver, somewhere in the bile ducts. It's like a total roadblock on the factory's shipping route.
And of course, the detective keeps digging for more evidence. Is there any pain? A sudden really bad pain might be a gallstone, but a dull ache could point to the liver itself. What about itching? Intense itching is another huge clue for a blockage. And things like a fever or unexplained weight loss, those help the doctor narrow down the list of potential culprits even more.
Okay, so we've got the patient story, the interrogation is done, now it's time to bring in the lab results. This is where we get to create our suspect profiles and basically sort the problem into one of 3 main categories.
This is basically our detective suspect board. Simple blood tests give us these incredible clues. If the problem is pre-hepatic, happening before the liver, we'll see high levels of that raw, unconjugated bilirubin. If the problem is hepatic, so inside the liver itself, we'll see high liver enzymes like AST and ALT, which are basically distress signals from damaged liver cells. And if it's post-hepatic, a blockage after the liver, we see a spike in a different enzyme called ALP, which points straight to a problem with the body's plumbing, the bile ducts.
Now that we've got our suspect profiled and we've narrowed down the location of the problem, it's time to call in the forensics team. We need some advanced imaging to get eyes directly on the scene.
And the first tool that gets used is almost always an ultrasound. Why? Because it's quick, it's completely safe, and it gives us our very first pictures of the scene. It can immediately tell us if the bile ducts look wider than they should be, which is a sure sign of a blockage downstream. It can also spot suspects like gallstones and just check on the general health of the liver.
But what if the detective needs a really detailed high-def map of all the plumbing? That's when they call for an MRCP. This amazing technology uses magnets to create a precise 3D map of all the bile ducts, and it's totally non-invasive. It's really the gold standard for finding exactly where a little stone or a narrowing of the duct might be hiding.
And just like that, by following the evidence from start to finish, we've gone from a simple yellow clue all the way to a specific diagnosis. The mystery is solved.
See, the case wasn't cracked by a single test. It was solved by following a logical, step-by-step process. You start with the patient's story, you let the lab tests guide you, and then you confirm your suspicions with imaging. It's just a beautiful piece of medical detective work.
So after going through this whole investigation, what's the one crucial idea, the main takeaway that we should all remember from this?
It's this: jaundice is not the villain of the story. In fact, you could almost say it's the hero. It's the body's brilliant, unmissable early warning system telling us that something deeper needs our attention. It isn't the end of the story. It's the amazing first clue that says, hey, it's time to start investigating.